Okay. Thank you to another episode of The Resilience of Black Women Confronting Breast Cancer. This is part of the Unexpected Detour series, and I am your host, Frances Hammond, and we are going to get started with these lovely ladies today. We're going to introduce Sonnet and Tamika. Other people will come on, I'm sure. So, Sonnet, tell Tamika a little bit about yourself. I know about you. So let her know, share if you don't mind.
Yeah. So back in December 2024, I was diagnosed with invasive ductal carcinoma, stage 2, grade 3. I just casually found the lump while I was sitting watching TV with my husband on the couch. And it alarmed me. So I got it checked immediately, pretty much. And within, I would say, I found the lump on the 3rd. And by the 16th, I had a diagnosis. So since then, I have gone on to have a double mastectomy. In January, I had 4 rounds of chemo, which I finished in June 2nd. And then I'm waiting to have my reconstruction on July 21st.
All right, Tamika, you want to tell her about you?
Yes, of course, my name is Tamika, and I am a stage 2, grade 2B, triple negative survivor. I was diagnosed in 2022 after I found my lump in 2021 after having a clear mammogram in January, and I found my lump in October. And so they diagnosed me in 2022. I had six months of chemo, double mastectomy, and the deep flap.
She had the red devil.
Yes, yes,
Uh,
that's normally the treatment for triple
the triple.
negative. So with triple negative, is nothing is feeding it hormone related or the HER2, which is like I guess it's the protein.
Right.
Yeah, so nothing feeds into the triple negative. They still don't know what triple negative is and what feeds it, but that's where that I got it. I like I told Francis in my interview is when they told me triple negative. In my mind, negative is good. And
Yeah,
it's like, no, negative for this is bad. And so
right.
I was like, oh, okay. So yeah, that's my story. And I started, of course, we was just talking about that before we got on my organization, Pink Breasty Sister, to give back to the breast cancer community and the cancer caregiver community.
Okay, and you all know my story. Age 60, and that mammogram, it said something. I don't know what it was, but it said something. So I'm stage 2B.
Hmm.
I just knew I was 2A. I went in there, I was all happy. I was like, I know what I am. Doctor was like, no.
Hmm.
No, I said, I'm 2A, 2A. She was like, no, you're 2B. I was like, I had a lump under this. She was like, yeah. But honestly, I've always felt that lump thing. I thought it was like a cyst
Hmm.
or calcium. My doctor said sometimes women get calcium there. So,
Calcium deposits. Hmm.
yeah, so that's what I thought it was. And he kept saying, don't worry about it. It's probably calcium. But it ended up being cancer. So I had chemo, I had radiation, and I had Herceptin. So that was for 18 months.
Hmm.
Yeah, so I had it. But Sonnet is getting ready to do her implants.
Yes.
So
So,
you're gonna
Sonnet,
explain to her that thing.
so Sonnet, what are you doing? Implants or are you doing a deep flap?
So I'm not doing a deep flap. That was
Hmm.
a little scary looking for me. So they're gonna do implants of silicone, but not the silicone implants that's like protruding. He said more so just for like the width and the shape of it. And then
Hmm.
I'm gonna use fat transfer,
Hmm.
the lipo to my breast.
From your stomach.
Yeah, and he said if it's not enough of my stomach, then maybe the thigh area or the back or something like that. Yeah.
So technically, you are getting the deep flap. So, you didn't get,
Well,
he
it's
didn't
just
say it like
lipo
that.
though. It's
Right.
just
Well,
lipo, not the actual like
oh,
cut
you're
to
not gonna get the
open.
cut. You're not gonna get the
Yeah,
cut. You're just
no.
gonna get the lipo. Gotcha.
Yeah, yeah.
Gotcha. Gotcha. Gotcha.
And
So
Gotcha.
she
that's
got
what
the cut.
scared me, the cut and seeing how big that scar is
Yeah,
and
it's long. It's from hip to
yeah,
hip. Yeah,
yeah,
it
yeah.
is
That's
definitely
what
from hip
scared
to
me.
hip. Mm-hmm. Mm-hmm.
And she's a nurse, so
Yes, and I
it's
mean
not just, she's a
and
nurse, mind you, though. And
and right, but
yeah.
that is when you're in the medical field. Even though I'm not on the clinical side of it, I used to work on the clinical side. Is when it's you as the patient, it's a totally different. It hits different.
Yeah,
It hits
yeah.
totally different. Yeah.
I'm totally not a nurse when it comes down to anything that's going on with me.
Mhm, mhm, mhm. It hits totally different when
Yeah,
it's you. Yeah,
yeah.
yeah, yeah,
Mhm.
yeah.
So you're gonna do what Tamika had? No.
No, what she's having is it's still fat transfer. So the original surgery that I had was the deep flap, but
Uh-huh.
in the revision form, that's where you can do the lipo, the fat, transfer to add fillers in. So what
Right.
you're
If it doesn't
doing,
look how you like it to look.
yes.
Yeah.
So Miss Francis, what she's doing is getting implants, and then the lipo is kind of like filling in the areas to make it look more presentable. That's what it is.
Oh, not what Tisha had, the thing that, remember Tisha had the cut and they put the thing in her?
But
What-
yeah, the what you're gonna have the so with your double mastectomy, what was your incisions? Are they round or are they across?
It's straight across.
And straight across. So hers is probably gonna be because she's not going to need expanders. She's literally getting implants. So they're going to reopen those incisions, place the implants in during the time that she's open. They're probably going to, they might even close you up first and then do the lipo and put it in like needles because that's how they did kind of like in the revision where he used the fat and kind of press the fat in with the needle. It just basically like they putting the fat in to make it more presentable.
Right.
Yeah.
So he says, because I have expanders in already.
Oh, you already have. Okay.
I've had that since my mastectomy, but he didn't expand me that much because I didn't
Okay.
want to be that big as I already was big for a really.
Right. Right.
So he says that he's gonna probably cut on the sides
Oh, okay.
and then slip the implant in that way because
Under,
he's saying
like
that
under.
this implant is not like a normal implant to where it's like
Mhm,
fully round. It's kind of
mhm.
it's more flat, but just more spread across this way, and then
Okay.
fill the fat in on top this way. So he said
Gotcha.
probably 250 cc's on each side of fat
Hmm.
is what he's trying
Gotcha.
to get from me. That's why I was saying if I don't have enough in my
He's gonna get
belly,
it from
he's
your
gonna try to get it
thighs.
somewhere else.
Hmm.
Yeah, yeah. And then, hopefully it's 6 because they say after 6 months, some of that fat could be reabsorbed by your body or, it doesn't stay. So that's when if you have to do a revision, then they'll go back in and do revisions because of that after 6 months. At least that's what he's explained to me.
Yes, that's correct. That's absolutely correct because even with the 6 months, give it time for your implants to settle in your body
Mhm.
and the fat that's already been transferred there to see if it's any um no alignment, like if it's something that's
The
off, like one
asymmetry.
side, yeah, the
Yeah.
asymmetry, one side may be smaller than the other or rounder than the other, then that's when they go in to do the revision and add more fat into those areas.
Yeah. Well,
Mhm.
but how did you feel with your deep flap surgery?
Well, fortunately, I actually felt good. I think maybe, and it's just a maybe, is I don't really want to go back in. It's a maybe I might go back in because I have gained some weight. I got a little back fat, so that fat can kind of come on out and pop it back
Yeah.
up, pop it
Yeah.
up here. So yeah, it's I feel good about my deep flap. I feel like I may need to work because like I done gained my weight back because I was much, much smaller when I had it. So, the handles, and it's starting to look like handles again. I'm like,
Yeah.
but I noticed that my fat, where they took the fat, is not coming back there when I gain weight
Mhm.
in that area. It's actually coming more to my thighs, my butt, my hips, my back, and on the handles. It's not coming in there. It's literally,
All the good parts.
yes, and it's not even net. It ain't even coming in that area, the flat area at all. It's
Okay.
almost like it's nothing there. It's completely flat.
Okay.
Hmm.
Yeah, because
I told you
that's
she's
what
an
I
expert on this.
Well, maybe let me reconsider what I want to do.
Yeah, I mean,
That's why I wanted you to talk to her.
because the only reason why I chose not to do the implants is because I know, at one point in time they was talking about implants, give you cancer, and you also have instances where the implants may explode or implode
Right.
and mess
Right.
up your chest walls. I also heard where, and this not even for breast cancer survivors, just implants,
Yeah.
period. You got to change them every 5 years. And I
Right.
was like, I really didn't want to go through all of that. And I was like, what's wrong with my fat, my, natural fat? I might as well just put it on up there and keep it moving. So that was the reason why I chose the deep flap, and it was one of the best decisions I could ever made.
Yeah. I think for me, it was either do the way that I'm doing it or just go flat.
And yeah, and the
Yeah.
thing is that that's the thing with deep flap, and a lot of people don't want the downtime, the healing process, because
Right.
10 to 12 hour surgery. Some people have it less. I don't know how, but mine was 10 to 12 hours. And then even with the recovery, it was for me maybe 5 weeks, 4 to 5 weeks. They normally
Uh-huh.
say like 6 weeks, but the recovery wasn't hard for me. But I know some other survivors that, even from my own plastic surgery office, that had problems, with infections, and the
Yeah.
recovery was so it doesn't always go as smoothly and as well. God just blessed me to go through it and didn't have
Right.
any issues. Yeah,
Yeah.
yeah.
Because my mastectomy was rough for me.
Mm-hmm. Mm-hmm.
I didn't feel good till well after 8 weeks.
Exactly. Exactly.
Yeah, and so I just started thinking about that, and I was like, oh, another major surgery. I don't think
Mm-hmm.
I'm gonna be able to do it because I was in too much pain.
And then it's not even just the physical, it's the mental of it all.
Yeah.
Because when my nurse navigator for my insurance, she told me not to look at my chest until a couple of weeks later. But I was hard headed, and I looked at my chest and I literally cried and felt like, I literally second guessed myself. And my sister was here with me. She came in from Atlanta, and she was like, do never second guess your decision. To say this is a journey that you're on, and you're gonna make decisions, but you're making decisions that's best for you at the time you're making it. So don't
Right.
never regret your decision. And so ever since then, whatever decision I've made for my body, I never regret it.
Right. I agree
Because
with
at
that.
that time, that's what you feel that's best for you.
Yeah,
Mm-hmm.
that's true.
Because mentally, it is it's a journey. Because even when you have your implants or the fat transfer, or even when you flat, it's the body imaging that you have to deal with afterwards,
Right.
and that it takes time. It does take time.
Yeah, I believe that to be true because having the mastectomy was a lot for me to
Hmm.
always have large breasts and then to go to this, it felt like a part of me was missing.
Mm-hmm.
Yeah.
Mm-hmm.
So that's why when I made my decision to do reconstruction, I was not ready to be flat. But now, if you ask me now, I'm like, well, flat, not flat, whatever at this point. Yeah.
Yeah,
I just want to be done.
yeah, because I know some survivors that are flat and they love it. They
Yeah.
have the option with the prosthesis with his prostheses, right?
Hmm.
And to be big some days and to be
Yeah.
small some days, to be flat some days. They can switch it up. So
Yeah.
it's all in the decision that you feel is comfortable for your body, going through after what we've been through.
Right.
Mhm, mhm.
Wow. Tamika, we're gonna give you a gold star this. That's how I learned from her.
Yeah.
So I'm always curious, and she always will educate you on her procedure.
Yeah.
Yeah,
That's
yeah.
why I wanted you to come on so you could talk to her and she could educate you. You ask her any questions you want. She can answer.
Right. Because I did the wrong thing. I went straight to YouTube to look at this
Oh
surgery.
no, don't
To
ever
look at
go
this
to
surgery.
YouTube.
And I was like, absolutely done. I
Now,
cannot do that.
now the one person I can say, and I told Francis this, that that was good to me. Her journey on YouTube was your favorite PO. Her real name is Brittany. She's here.
Yes, that's who I
Yes,
saw. And I was like, there's
yes.
no way I can
She
do
is,
this.
baby. Brittany is. I met her. We
Yeah.
we talked. We text each other. Baby, Brittany kept it real and kept it
Yes.
funky and kept it. And she helped me with some of the things that I saw her in her recovery on
Right.
when I went back to my doctor. Okay, when she did the video about her navel and she didn't
Mhm.
have no navel. And I'm
Yeah.
like, why would they not give her a navel? And so in my mind, I'm like, so am I not gonna get a navel? Is
Yeah.
that what they do? So I went back to my plastic surgeon. I'm like, hey, am I gonna get a navel back
Yeah.
after? Because he was going over the procedure, how he gonna pull it and snatch it. I said, but where's my navel gonna be? He said, what do you mean? I I said, I saw somebody that didn't have a navel. He said, why would I not give you a navel? I said, I'm just asking.
Yeah.
I want to be sure on what we got going on. And so,
Right.
and that's the one thing I loved about my plastic surgeon, Dr. S. That's what we call him. He was very upfront. You ask questions, he tell you. He literally went over the procedure with me from top to bottom on the scans on how he had this vessel, this vein. I mean, he was pointing them out. I'm like,
Oh, real
okay,
thorough.
okay,
I love
yeah,
doctors like that.
yeah.
Yeah.
And he, told me, okay, but we're gonna pull it down and we're gonna put your navel here. And I'm like, okay, okay. Very detailed. And that's where the relationship, the bedside manner come in. He
Right.
had superb bedside manner. Even now,
Right.
bedside manner is on point.
Yeah, that's real important. That is
Yes,
definitely really, really important, especially when you're navigating something so sensitive as this,
yes, yes.
um, because
Now the
I
question,
met with someone who was very um, oh, you're gonna be beautiful, and I'm crying. No, we're not there
right?
yet.
Like, no, I'm
We're not
crying
there
right now.
yet.
I need you to comfort me.
Yeah,
Yeah,
yeah. But I
yeah.
think he was mostly used to dealing with people who are doing this for cosmetic surgery. So,
Mm-hmm. Mm-hmm. It's a totally different conversation and feel when your plastic surgeon understand you're not doing this for cosmetic. That
right,
this is a life altering. Like when you have a double mastectomy or even a single mastectomy, you're
right,
literally, and people don't want to call it this, but it's an amputation.
right,
Your breasts are now gone. It's like
right,
taking a leg, taking an arm. They're gone. So it's the sensitivity that when you have a plastic surgeon that is sensitive to your needs and your situation that makes it so much better.
Yeah.
Mhm.
Oh, so it's the plastic surgeon that's doing all of this reconstruction?
Yes. I
Oh,
know with mine. Yes.
Yeah.
you
Yes.
too, Sana,
Yeah.
a plastic surgeon, but they're
Yeah.
oncology plastic surgeons, right?
Right. But
Yes.
some of them don't have to be just oncology. They
Exactly.
can be
A
just a
plastic
plastic
surgeon.
surgeon, but they also do oncology.
Oh,
Yes. Yes. Because
But
my
I also have a oncology
surgical
breast
oncologist.
surgeon.
Yes.
Yeah. So
give 'em
she's
my
the
girl.
one who, like, they did it together.
Mhm.
My oncology breast surgeon, along with the plastic surgeon, went in and did my mastectomy and took everything out together.
Exactly.
And, but
And that's
now
how
I
they're
just
supposed to
kind of
do
see the
it.
plastic
Mhm.
surgeon for
Oh,
reconstruction.
my beautiful Tequila. That's Tequila.
Hello.
Unmute yourself.
Hey ladies, how y'all doing
That's
today?
Sonnet. She's new to the group.
Okay,
She's
how you
she's newly
doing?
diagnosed in December. She had
Oh,
her
I'm
breast
sorry.
removed.
Yeah, we're
Well,
talking about
I've
reconstruction.
gotten
They
through
talk
it.
about
Yeah,
your
I've
favorite
gotten
subject,
through.
reconstruction.
So I'm having reconstruction on the 21st of this month. So
Oh,
Okay,
just trying to
okay,
get prepared.
congratulations. You doing a double?
Expect, yeah.
I just did it.
Mhm.
let
And
me see.
how are you,
How
Tequila?
you
How did
looking?
your
How
surgery
you
go?
looking?
You know,
Uh-oh.
Uh-huh.
Uh-oh. Look, look, look.
it's,
Okay.
Oh,
it's they're giving. The boobies is giving, and
Yeah.
oh, come
You
on.
didn't
I
do
didn't
that
have
D
this
flap
much.
though, right?
Huh?
You didn't do the D flap, did you?
Yeah, I did.
Yeah,
Oh,
she
she did
did.
what?
Okay,
Oh,
you
she
did
did what?
it. We were just talking about how I'm afraid of that surgery.
Oh, baby.
So which one are
So,
you
but that,
planning to do?
yeah, that's
So we're doing implants, like a small implant with fat transfer.
Mhm.
I'm scared of that. I'm scared of it. Oh my God. I mean,
Yeah.
it's definitely to each his own. I completely understand. I think for me, what made me make the choice was because I had did a weight loss surgery prior to being diagnosed.
Mhm.
And so I had that tummy skin because I've had 4 kids and I had 4 C-sections.
Mhm.
So, that muscle wall was already broken down. I had, that broken down goodness. Look, now it's goodness. At first it was a
Yeah.
nuisance. At first it was a nuisance. I had all that goodness or whatever, but it was a concern about whether or not it would be enough because I had lost so much weight.
Okay, yeah.
But when it was all said and done, I got what's called a pantylectomy. It's like a partial tummy tuck, with no lipo.
Okay.
And I was able to. My goal was to get to a C. I never was even a B plus. Okay, I was like a B flat my whole life.
Yeah.
So that was my goal, and they had told me like, okay, well, we could potentially do the deep flap, and the benefit of the deep flap with what they called it a hybrid. We could do the deep flap, but then we would have to go through with, like you said, some small silicones. And the benefit of the deep flap is once somebody touches, it feels like
Right.
that's
Just
it.
like you.
That's it.
Yeah.
Right, where
yes.
you'll be using fat to kind of cover that area or
Mhm.
whatnot. So, and what I will say is that it ended up turning out like the size and everything ended up being more than what I anticipated. I'm sure probably more than what they anticipated too. And so now I don't have to do the plastic because I was really concerned about the foreign object
Yeah.
plastics in my body type thing or whatever. Like I said, I don't want to even put none on that one. But so I'm glad that I actually did go this route. And what I did notice, I was diagnosed in my right side. I
Me
can
too.
tell that skin because of course I went through a mastectomy back in 2024. Was it 2024?
Mhm.
With it. And then of course I went through radiation. I said 2024, 2023. I'm sorry. I went through radiation, you know what I mean? All of that. So that side was a bit more manipulated with the skin and it was thinner and it had just gone through much more.
Mhm.
So
Yeah.
now in this healing process, I just had this on the 16th. I can see that my body has already accepted the left side. So I chose to do a mastectomy on the right side that I needed initially. And
Mhm.
because I had to do the lymph node removal, and I had did something called a they were trying to prevent lymphedema.
Mhm.
It was called a bypass or whatnot. So I was a little nervous about knocking out a double mastectomy at the same time, considering that I had to do so much on the right side at one time. So I just got the left side mastectomy and replaced the same day.
Wow. Okay.
But my body
You was
seemed
in there.
to what'd you say? I didn't hear you. What you
I
say?
said you was in there.
Man, girl, they hooked me up. I ain't even gonna lie. But my body seems to have accepted that side. I ain't gonna even lie, y'all. It jiggled like it is with me and like we go together early.
Yeah.
It's the
That's
other one
good
that's
to hear.
kind of a little different. You know what I'm saying? Like I said, because that skin is a bit, a bit more worn.
Yeah.
It's a little bit, we'll call that the seasoned side. You know what I mean? But overall, the crazy thing is that nope, not yet. Wait a minute, y'all. The crazy thing is that if I had to like look at them right in front of me, you know how as women we normally won't have twins, like
Mhm.
matching
Yeah.
twins or whatever, right?
Mhm.
So if I look at the side that's manipulated, it looks more like the plastic booby side. The
Okay.
other side looks more natural.
Right.
Mhm.
But I can already tell though that the manipulated side does have a little bit of more like it's got a little fat necrosis
Okay.
where the breast had to meet like my arm area, like they try to
Mhm.
take it over that area. And they said that that is normal and your body kind of typically will absorb that or whatever the case may be. But overall, so good. I'm so
I'm
glad that I
so
went this
happy
route.
for you.
Yeah,
Don't be showing no bikini pictures every
girl,
2 months when
girl.
it's cold and you in a bikini.
Stop hollering. Now, the funny part to me, though, out of everything, I will say, I really appreciate having my fat girl navel. Like, I don't got
Okay.
that tummy tuck navel. That tummy tuck navel look a little strange to me. I
That's
got
what
like a
I'm
regular.
afraid of. That's what it was like
So
making
you
me
got
not
you got an
choose that
outie or
option.
innie?
Yeah.
You got an innie or outie?
I do see. I always had an innie, but it's perfectly right. Look, my kids keep talking about when your umbilical cord gonna fall off. I'm like, I got a damn umbilical cord, but it's the little, it's the little crust, but it doesn't have that weird little elongated. You know what I mean? Like that
Yeah.
weird
Mm-mm.
look just like a
A
regular
navel,
navel.
navel.
It
Yes,
does.
Oh,
Like
that's
I
I'm
when
said,
you
so
that's when you
glad.
got a good plastic surgeon. That part
I've
right
always
Right.
had an
Yeah.
any
there.
though. So
That part right
I
there.
even and remember because I didn't have lipo, I still kind of got that little. I'm still swollen, but I still got that little pooch, just a
Mm-hmm.
little pooch.
So
So
it's looking natural.
it looked like I ain't did nothing. If you don't pull myself down to go past that little scar area, you
Uh,
would have no clue that I ever had anything that happened down there.
wow.
So
So
it's
that just means I need to come and see your surgeon.
girl.
Both of
Look,
you are in Florida.
Well,
wait,
Together,
y'all both in
isn't it?
Florida.
Yeah,
You're
where?
where
both
in
in
Florida are you?
Florida.
I'm in
I'm in
Tampa.
Tampa.
So is she.
What hospital you go to, girl?
I'm at Baycare.
Back there. Where? Which one? Like, is it
North,
in Tampa?
St. Joe's North.
I know exactly where you at. I go to Moffitt.
Okay.
Yeah, I go to,
I was waiting to get into Moffitt. Moffitt had a long wait.
you know what? I will say, it seemed like right after I got diagnosed, and maybe about a good 6 months in, I had a couple of people that I knew that got diagnosed right after me, and they struggled to they couldn't get in because it
Yeah.
had like bagged up. But they did just open a facility. I actually live in Ruskin, and they just opened
Okay.
up a new facility so that they can accept more clients that come from Sarasota and all those other areas and whatnot. And therefore they do another expansion. But I have heard that, and I know people who worked for Moffitt and couldn't get in Moffitt.
Oh wow.
Yeah.
What
Yeah. I
So
mean,
hospital
because
do
you
yeah.
know
you work
everyone wants
for,
to go
Sonnet?
there. Huh?
What hospital do you work for, Sonnet?
I don't work for the hospital. I'm actually on a leave right now. I do home care with
Oh, okay.
babies.
Oh, you do the
Yeah,
baby
the sick
stuff.
babies, babies that need to be on the vents and the trachs, and
Oh,
yeah,
Oh,
I
okay.
help transition them to be home with their families so that they usually do better when they're at home. So
They do. Yeah, they do.
oh, so you
That's
two gonna
all.
have to hook up.
Of
Yeah.
course. I'm
Both
all
in
for it.
I mean,
Tampa.
I'm on the other side. I'm up north by Wesley Chapel. So
I know where you at, girl. I'm right off 75, so I
yeah,
know how to
I
hop on
am
the highway.
right off 75
So
on
you know where
270.
each other
Yeah.
are located, huh?
Yes, that's so
That's
funny.
Yeah, so
different.
that means that I need your surgeon.
Yeah,
Because he's close.
definitely.
That means I can get to him.
Definitely, definitely. And not only that, just maybe even, like I said, just having a different perspective. You know what I'm saying?
Yeah,
On how you
right.
not to change your mind or anything, but
Mhm.
just give you some options. Because I will say, let me tell you what made me change my mind.
Mhm.
I saw one of my girlfriends right after I finished radiation, and she had just finished having her reconstruction.
Uh-huh.
And she's a thinner lady. And she had opted, to do a full removal. She had did spacers,
Hmm.
and I think she was kind of on the fence. And at that time, I really didn't know a ton about all the things, but I remember giving her a hug, and
Mhm.
I felt like her plastics literally like on me.
Yeah.
You know what I mean? Because she said she didn't want any fat,
Mhm.
and she was
Oh, okay.
already very thin. But they were
Mhm.
gonna
Yeah.
go back and do what you said, where they were gonna put, some fat around it. But that's what made me was like, oh man, I ain't never think about, how plastics can appear to be, they can kind of come off as unnatural. It's
Right.
depending on the type
Yeah,
that
that's
you
true.
get. You know what I mean? Like
Mhm.
just kind of depending on what you get. And that's what made me say, okay, wait a minute, let me look and see what other options are available. Because at that time I was just gonna go flat because I
Right.
thought it was the only
That's what I
thing.
was-
I didn't know nothing.
Yeah.
So
Mhm.
that is what gave me the opportunity to have my moment of like, oh, okay, well, I know I don't want that, but let me maybe investigate this a little bit more because I was happy to see her with just that womanhood. You know what I mean? Like the
Right.
formation in her shirt. And because I had saw her without it. So to see
Yeah.
her back, it just kind of made her look a little whole, a little bit more vibrant. And I was
Right.
like, dang, I
Exactly.
didn't think I would miss that. I didn't really think that would matter so much.
Right.
And so that made me feel good for her. But then again, like I said, when I was like, okay, cool, she happy with this. I don't think I would want that, but I kind of think I want to investigate this a little bit more. So it was a good, little moment to get me back in the realm of what I want, how I wanted to customize my own experience.
Right.
So yeah, definitely. We'll definitely have to link up.
Yeah.
How are
I
you
have a
doing, Miss Vanessa?
question. I have
Oh
a
yeah.
question for both of you. Since I'm on the back end of it and y'all newbies
OG
to it.
status.
Look, y'all newbies to it.
OBJ.
Newbie. You gonna did either one of you did nipple sparing?
I couldn't.
You didn't do it either. Okay.
No.
So
Yeah, they said I wasn't going to be able to either just because of the size of my breasts.
mm-hmm.
I was already like all the way out here. I was a 38F.
Mm,
So
Woo!
when they took everything, yeah, when they took everything out, it wouldn't have what did they say? It wouldn't have survived. The skin wouldn't have survived because of
got you.
how
What
much.
was
Yeah.
your diagnosis? I'm sorry, I'm trying to get caught up to speed.
Yeah,
Mm,
tell her, you could tell her when you got diagnosed on it.
I got diagnosed December 16, 2024. After I randomly found a lump in my breast, so just sitting on my couch with my husband, kind of like how I'm rubbing my arm right now.
mhm,
That's what I was
mhm,
doing. I was just going like this, and I was like, what is that?
mhm,
Because it
mhm.
alarmed me. I felt it on December 3rd, and I just started calling people immediately. And by the 16th, I had the diagnosis of stage 2. Um, and I didn't say before, but I am estrogen positive as well.
Okay, okay,
Yeah.
okay.
So
And
I
so,
went through chemo. I had the mastectomy in January, went through chemo 4 rounds. I didn't have the red devil. I had doxycycline and cyclophosphamide. So to them, they said it was, like a milder chemo drug. And I just completed that on June 2nd.
so
So
you had a mastectomy first.
yeah.
That'd be so crazy to me how,
How
like
everybody's
that.
different.
Different is it's different for
It's
Yeah.
everybody.
different. Every
Yeah.
journey is different. It's
And I
every
asked
journey
my
is different.
doctor for that. I was like, can't we just cut this off first
Mhm,
Yeah.
and then do all
I
the
think it has
things?
to do with this. where
The
it is, the
size,
size,
where
and
it
all of
is,
that.
and the size.
It
Yeah,
does.
and I didn't have any lymph node
Lymph node,
involvement or
okay.
anything. It was just literally right there.
Mm,
It
Okay.
was very superficial to the skin.
Okay.
So
okay.
I
What
think
made
they
it
thought
stage
in
two?
that they would just wanted to take it out so it didn't spread anywhere. That's in
What
my mind what I'm thinking.
was it, large or something? Is what made it stage 2 in
It
that?
was 4 centimeters.
Okay. Okay.
Yeah. So I think they just wanted to get it out
Mm-hmm.
or it
Mhm.
got any worse.
Mm.
And what made you opt to do a double mastectomy?
I didn't want to deal
Considering
with it.
that,
I didn't want to deal
huh?
with it. I didn't want to deal with it again. Like if it, would come back, because my breasts were so big, they were dense. There were fibrocystic changes on both sides. They just didn't find any cancer on the left side. So I was like, I don't want to risk it coming back in this side or wherever, So I was like, all right, let's just
Get rid
get,
of it.
yeah.
Did you
And,
do?
and to be honest, I cursed my breasts since the day I got them. Because they were just so big for so long, and it caused me so much trouble growing up. My back was hurting, my neck was hurting, the breasts were burning. They were just doing all kinds of things. I really didn't want them anymore, and that was just an excuse to be like, okay, well, I can.
Don't get rid of them.
Yeah, yeah. Because I
Okay.
know I was never going to get a reduction because I always was thinking about getting a reduction,
Mm-hmm.
Mhm.
and now that I think about it, I probably should have, maybe I could avoid this, but I was never going to agree to get that surgery on my own.
Gotcha.
Yeah.
And was it a genetic? Any genetic
No,
connections or just? And you might me ask, how old are you?
I'm 38.
I figured that. Yeah, I figured you were under 40. I figured that.
Mm-hmm.
That's
Mm-hmm.
crazy.
It's crazy how the young women are getting it.
Yeah.
Mhm.
Yeah.
Yep,
That's
I
what's
figured that. Yeah,
crazy.
she was under 40. Yeah.
That's
Yeah.
I've
really
been running
crazy.
into a lot of women under 30.
Yeah.
Yes.
Yeah.
Yeah. In their 20s. Mm-hmm.
Yeah, me too.
And
And
some
they
in
be
their
stage
teens.
4. And they be
Yeah.
stage 4.
Mhm.
Which you said 13?
No, I said in their teens.
Oh,
Been some cases of teens. One of the breast cancer survivors I know here, she went to the breasties camp, and I think she said it was a young lady. She was either 16 or 17 with
Wow.
breast
wow.
cancer.
Yeah, they said the youngest on record was a girl that was 5.
Yeah.
Wow.
Really, you got
Mhm.
me being very careful about a lot of stuff now.
Yeah.
You got me being very conscientious of a lot of things. Product
Oh, me.
is your fault. Yeah.
I mean, I literally told somebody Saturday, it's not necessarily always what you put inside of you, it's also what you put on you.
Right.
Yeah.
I
On you,
mean,
around you.
because it can be anything. It can be from the detergent, the
Yeah.
soap, the deodorant, I mean, it could be anything. Cause like it was something floating around on Instagram recently where they was talking about deodorant don't give you cancer. No, it don't. But something that may be in the ingredients
Right.
that give you cancer.
But that's
So
what I
it,
was thinking, that mine
yeah,
was from the deodorant because I had
yeah.
that lump there.
Hmm.
I was like,
And
it might be the deodorant. So I
it might
stopped
just been
using
the
that one.
brand. It might have just been the the brand. It might have been your soap. It might have been your detergent. It could have been
Mhm.
so many things. And that's where I'm glad the research has started to expand and women are getting more knowledge now about um, some of the causes of cancer or some of the things to look out for when it comes to ingredients in your products.
Yeah.
But
Yeah.
like Tequila said before, you be damned if you do, you damned if you don't.
Damn
You
if you
tell
don't. Yeah.
people,
Because you could be the vegetarian and still get cancer.
yeah,
So it's just like
it's a catch-22 because we don't
yeah.
And
ever
it's
know
funny
what to
because
do.
like something we just learned about one of my daughters, she got a freak little girl, as my kids say, she like allergic to earth. That's what they always like. You're just allergic to earth.
Yeah.
Um, and with her, we just found out that she's always had like a variety of environmental things, but you can be allergic to the plants that are pollinated
Yes.
from
Yeah.
other plants.
Mhm.
And I'm just like, this crazy. And so if it's raw, it has a reaction to it. But if it's cooked, she fine. And what that looks like is, cherries are helped by pollination, watermelons are helped by pollinations, kiwis, you know what I mean? Some are a bit more grown aggressively, like I guess seed based or whatnot. And this is a new allergy that has grown with her. Like she grew into it. It wasn't what she had at first. So, and when you think about like just even thinking about that, right? I'm like, you know what? I guess I would prefer you to probably eat it cooked than raw. Because look at all the things they use to fertilize and the fake pollination that's in
Yeah,
place to try to help those things germify and fertilize and all of the other crazy stuff.
that's that seeding thing that they do.
Yeah. So yeah, it's like you said, it's true. It is, you're damned if you do and you're damned if you don't. And for me, I'm just like at this point in my life, it's just more mental. It's just like one of them things like I feel good just, like knowing that I'm actively doing the things that let me know that I'm doing the best that I can in
Right.
order to eliminate so many toxins in my body.
Right.
Because when I look back at my old blood work, I was like, damn, how was I even up walking around? I was like dead trying to do blood work. You know what I mean? Like when I look at it. And so now, as I've gotten through chemo and I've gotten through all the things, and like even how I had to prepare my body for this surgery, I'm just like, oh my, I was like so proud of, because I make certain I try to take as clean of vitamins and things that I can take, and, making certain that my body absorbs certain things that we normally struggle with to absorb from foods. And
Right.
so I was glad to see the work literally coming to fruition through the paperwork, as it came time to prepare for this. So I mean, it's gonna be whatever is tailored for each
They're
person, but
like freezing it.
hmm,
Hmm.
I ain't hear you. What you say?
Let's say Francis.
Though she was freezing, I think it's me.
Oh.
Yeah. Go
Oh,
ahead, Shaquille, keep talking.
yeah, no, I was just saying I was just glad to see everything come into play, in my blood work, because that's of course where you start to recognize when you finding out later on, because I never knew that vitamin D can
Yes.
create my whole body to start to attack itself. I had no
Yes.
clue.
Hmm.
I'm thinking I drink milk all the time. I eat cereal. I know I got enough vitamin D. I'm a cereal junkie. Had no
So
didn't even
do you see like a functional doctor or anything like that? Because that's what I was looking into to be able
girl,
to do the blood work to find out how my body is functioning or malfunctioning so that when
girl.
you're supplementing, you know exactly what you need specifically because I personally believe everybody is different. So something that works for you may not work for me because that's not my deficiency. You know what I'm saying? So that's what I was looking into.
That's right. So, look, girl, look, my PhD in the streets is I am a functional doctor. No, but no, 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 no. So I ain't gonna even lie to you. I look at it's called a doctor of osteopathy. That is a Western version of a functional physician. Okay, a
Okay.
doctor of osteopathy. So, of course, our insurance won't cover functional physicians. But I utilize the healthcare system as much as I can, and I'm pretty manipulative when it comes to kind of getting them to do what I want them to do.
Mhm.
And you know what I mean, with getting certain blood work, because I think it's crazy how you literally go in and they say you got hormone breast cancer, but when you done, they don't give you to an endocrinologist. Like I think that's
Right.
Because
That just sound logical that they would.
prior to all of this, I was suffering from polycystic ovarian syndrome where
Mm.
I already knew my hormones were off, but I didn't know how I was supposed to get that regulated because
and they always say it's birth
they never
control. That's
gave
all they
me
ever try to
anything.
say.
Yeah,
Yep.
but I never wanted to be on birth control because it didn't make sense to me. If polycystic ovarian syndrome is gonna make me infertile, then what do
Yep.
I need birth control for? It didn't,
Hmm.
it just
Hmm.
it didn't, it didn't add up to me
And
right. So I
they
was like,
don't
I
even
don't want
talk
to take
about
that, and I just did.
they don't
And
talk
to be honest, I didn't take it, and they said that I would need help getting pregnant, and I got pregnant just fine.
and they
Mm.
said they don't even talk about all the side effects of like do the risk outweigh the benefits of doing
Right.
you know what I mean, doing that birth control in order to, reduce your PCOS. So that's funny that you even bring that up, but like one of the underlying issues, one of the big underlying issues for PCOS is insulin resistance.
Mm-hmm.
And they don't even talk like they really
And
connect
inflammation.
that. Yeah,
Yeah.
inflammation and insulin resistance. And you don't even have to show up in your blood work with having a pre-diabetic A1C.
Right.
It's
Right. Which
different.
I
It's
haven't.
totally different from that.
Yeah.
And that's the connector like that some people don't, well, physicians don't dig deep into because they divide the specialties and they
Mhm.
don't come together to have that conversation. Well,
Right.
that's where a doctor of osteopathy comes into play. They're kind of like a primary care physician where they're going to pay attention to the whole you. And that's
Okay.
like the best way to get your money's worth through your insurance to kind of cover all of those. But you really can lean on your primary physician. And
She ain't no good.
and I was just gonna say you got to move around. Right? You might even have to move around. I swear to God, I was just gonna say that because some of them be thinking that they like they think you work for them and not they work.
Mhm.
You know
Right.
what I
Right,
mean? And
right.
some BS. So, but I will say, so I just moved here a couple of years ago, and I
Okay.
think that I've been very fortunate with the physicians that I've met. But I ain't gonna even lie to them. I come in crazy. I come up in that mug like the lady, crazy lady from hell. You're not gonna tell me this. I'm gonna hear you. I hear everything you saying, but I'm gonna now question everything you just said.
Okay.
And it literally, they be like, okay, like they be bringing in teams to talk to me.
Because they know you about to act up.
Ask 50 questions, like, nah, like, yeah, we ain't even finna play this game with her because she gonna act stuff we don't even know. You know what I mean? So, like, it's so funny to me, but it works and it
No,
helps to knock them off of that rocker or that high horse.
yes,
But I would
that's true.
say that's probably the best thing that I could recommend to you if
Now,
financially
we
getting a
have
naturopath.
somebody else joining.
Who is that? I'm so sorry.
Her name is Farida Thomas.
I'm Miss
Boo from
Thomas.
ATL.
You
Hey,
know her?
okay.
Yes.
Hey,
Oh,
I'm
she talks
driving,
to me
so
all
I'm
the
trying to.
time on Instagram.
Yeah,
Oh,
Frida,
thank
and
you.
I know Frida from Atlanta. She's been at my pop-up. She's spoken my pop-up. We talk, text,
Okay.
all of that. That's my breast cancer sister at ATL.
Mhm.
Oh,
Thank
Farida, you
you.
ain't telling me that.
Oh,
We gotta see your face.
She said
And
she's
at least, look,
Driving.
driving.
She
at
said
least
she's
bring it,
driving.
yes,
What
I'm
you
at least
say,
driving.
bring
So
your
yeah,
lips
Oh,
because she
trying to look
breaking up.
forward
oh, she's
into that.
driving like, but to Quill, you be showing your face.
I don't, yeah, because I know you probably can read my lips because I can't. She breaking up wherever she at.
Oh, okay.
Yeah,
And,
because I was even when me and
Your
Michelle
friend,
was on, I was trying to drive and look and
yeah.
drive. I'm like, that's a little dangerous. That's a little dangerous. That's
yeah.
Hey, I just popped that
no
thing right
more.
up on the dashboard. I
Right.
don't even thinking
Oh,
y'all with
Farida,
me at that point.
you could
Everybody
just
can get it.
listen in, and you know,
Okay.
Yeah, definitely.
yeah, you can listen. And they're talking about what's that?
Reconstruction.
Reconstruction.
And naturopathic physicians. That's what we're talking about too right
Yeah.
now. So overall, though, I'm from St. Louis. Sonnet, is it Sonnet or Sonnet?
Sonia,
Sunday.
Sonnet. I
Hey,
love that name
thank
too. By the way,
you.
that's so pretty.
don't worry, I
But
said it
I'm from
wrong
St. Louis,
too.
Missouri, where hoodoo, voodoo, natural physician, all of that jazz. Like we live that life there.
Yeah.
Here in Florida, they probably do. I just ain't really tapped into it. And I got to be honest, from what I can tell, it feels that it's more Caucasian-y.
Okay.
And
So Tampa, yes.
I'm not against
Tampa,
it.
yes. Like my family is South Carolina Geechee, so I understand all of
You know
that.
what
But
I'm saying?
here, even just like a regular therapist, they just don't have anything for us here.
Mhm.
I
So
looked and I'm like, oh, the closest was like in Miami somewhere, and I'm like, okay, that's not gonna work unless
and
it's
it's about to be,
online.
it really be Haitian chicken probably or something then at that point, right? Which I
Yeah,
ain't against
yeah,
none of it. I'm not against none of it because
yeah.
if we resonate and we marinate with one another, I'm with it. But I
Mhm.
haven't really ran into any naturopathic physicians here. I ain't gonna lie,
No.
part time between here and there, so I'll go home for any kind of treatments. Ain't nothing off limits
Okay.
now in my mind with my life,
So
you know.
your naturopath doctor is in St. Louis.
No, so I have like I've always seen a naturopathic
Oh,
physician.
okay,
So
okay.
yes. So yes, but
Okay.
overall, I'm not gonna lie. A lot of the stuff that, because of course, changing your lifestyle, it feels like I spend, of course, which you probably, you will. I spend more money now trying to just live cleaner, live better, right?
Yeah,
So
which
I
is
try
worth
to.
it.
Yeah, it is. It's so worth it, right? But and in the past, I kind of would pay for insurance, but I never thought I needed to go to the physician. So I never utilized that
Right.
tool. Well, now I
Mhm.
ain't gonna lie to you. I try to exercise. I squeeze every dollar, nickel, dime out of them folks now. You know what I mean?
That's
To
right.
Yeah.
try to,
Mhm.
utilize all of their specialties. Look, I just got actually into a quality of life study where they're going to be paying me $50 a week for 12 weeks to buy whatever I want to eat, how I want to eat, or they're going to be supplying me food 3 meals a day so that
Mhm.
they can kind of monitor everything. And then they want, of course, my stool or whatever to see
Yeah.
how that happens. But they checked my fat and everything today. So that stuff, like I be on them about everything. I see a dietitian. Do you know a dietitian can write you a script for fruits and veggies?
Yes, I heard that. My sister actually told me that. Yeah.
Girl,
You know,
yes.
we have this insurance and we don't use it. Like I
Right.
started going through like since all this happened, I started going through all the service and things. I'm like, what? I can do that. Oh, I can get that
Wait,
off.
wait, back
They
up.
even give
The-
you like the
They
gym
can write
membership for $20.
prescriptions,
Like, yeah.
the
Did you?
dietitian for what, fruits and vegetables?
They will literally, if they're selling you that if you're like, I eat those, I know of those things, but I'm not familiar with them, and blah blah, and they're saying you need to have excess this, that, and the other in your diet. They can legit write you a script or provide you services to where you get fresh fruits and veggies as like insurance or as like a medical
Really?
subscription.
That's
Yeah.
good to know.
Yeah.
It's so many things. Like I do acupuncture, girl. My fit, I go there and I get what do you call it? Massages. I do massage therapy on insurance.
Yes, I just saw that. I saw that yesterday because
Mhm.
I was needing massage for a long time. I was like, I'm stuck. I'm in pain. And I was like, oh, they do it at Moffitt. I live literally like down the road from Moffitt. So it's like
Okay.
I saw that they do the acupuncture and the massage therapy
And
there.
it's for women who have had breast cancer. And the lady who does the massage therapy is a breast cancer survivor.
Oh,
So,
wow.
but do you need to be a Moffitt
Patient. That
patient?
part I don't think so because she works through the facility, but she's with USF, not
Yes.
like my
Okay.
fit. You know what
Mm.
I mean?
Okay.
Which
Yeah,
allows
I
her
need all the
to.
information from you. You might just put it in the chat.
No, you're gonna exchange numbers in
There
that.
you go
Yeah.
to right there. Yeah. Yeah.
Yes,
That's how
Yeah.
you do it. Exchange
yes,
numbers.
definitely. Yeah. So I
Absolutely.
would advise anybay look at your insurance or look at
Right.
your employer
Rita
because like I
said
ain't
she
gonna even lie.
uses
I
her
was
insurance.
and I was pissed about I missed the deadline, not knowing like my part-time job had offered Aflac. So I didn't get to
Okay.
sign up
Back
for
again.
she trying to come back in again.
I saw her
And
there.
here's in one of them.
It's
But
a
I didn't get to sign
there
up for
because she was on a different device. So.
I see.
Yeah. Now let's see if we see her.
See her, right, yeah.
I didn't know you knew her, Tamika.
Yeah. That's my
I
girl
just talked
right
to her on Instagram. That's how I know her. She likes everything I put up there, and
there.
I feel blessed.
Yeah,
Oh,
this
and
a good
she
turnout
said
today.
she's come. Yeah, it's a good time,
Mhm.
especially when you and Tamika on here. Always a good time.
Yes, yes. Like I enjoy it.
Yeah, I know you do. That's why I text you. I
Yeah,
said, you
because
coming?
and
Yeah.
the chemo be having me so flighty. I said, what's she talking about today? Am I joining? Oh, I'm like, oh, shut up. Shh. Go,
You
go.
told me to always
Now let me get
remind you.
myself together.
Yeah, she told me remind her all
Remind me
the
somewhere. I
time.
tell her, like, if you want me to come, just text me, because I won't remember. I'll be horrible
No,
with
she
that.
don't remember. But you two can exchange numbers.
Yes.
The number in the group chat, so you can have.
Yeah, that's what I was saying. I'll
But
put my information as soon as I figure this out because I'm
Oh, okay, yeah, I got.
go to the chat and
I see it. Yep, I'm gonna put it in there now for you too.
let me see. She got a new
There
message.
we go. I got me in there already. Oh, there we go.
Okay, they go to Quilla.
Yep. And text me from there. Don't put it in here, girl. I ain't gonna. I'm bad. Oh God. But
Oh,
I'm
she
old.
wants you to text her your
Yeah,
number.
Sunday text
Yes.
me. I'm old. Don't you muted yourself too, Sunday.
So Nay,
Yeah, she trying to unmute herself now.
she can hear us.
There you go. Now we can hear you.
I got it.
Yeah,
Okay,
yeah,
now you can text her, and you got Tamika gave you her number.
Yes.
I'll give you my number. That's how we keep in touch.
yeah,
Okay.
Mm-hmm.
We're a good group here.
Yeah.
yeah,
You
Yeah.
just
yeah,
didn't get to see the rest of the ladies because
yeah.
they had something to do.
Understood. How is why come I can't? It's on the tip of my tongue. Good Lord.
Let me take
A
this.
little bit.
That's in Florida too.
She was supposed to be here, but she
Thank you, Sunday. I
said
got.
she as usual, well, her little squirrely brain, she forgot that she had
Okay.
family coming.
That don't matter. Let her live. That's how it was. We can
Because
come
I said
breathing.
they probably coming because remember she had that hysterectomy.
Okay. Okay. That makes sense.
They
Is that
come.
something, Sonia, that you considering? Did they ever bring that up to you?
No, I
Okay.
thought about it because they want me to go on tamoxifen, and I really don't want to go on tamoxifen.
Okay.
So I was going to ask them, well, what if I get a hysterectomy? Would that change anything? But I guess we'll see.
So yeah, that's because I think me and Tamika, you on nothing, right?
No, I'm not on
Okay.
anything. Yeah.
I forgot. Yeah. And Francis, you are no
Yeah,
Francis.
I take a natural, so
That's
remember?
what I thought. Yeah.
Yeah.
And so you and
It's
I,
Tisha that takes the tamoxifen. Remember, she's
okay.
like
And
30 something
so
years old too.
and Francis, you were HER2 positive, and Tamika, you were triple, right? Negative, triple
Negative.
positive.
Mm-hmm.
And
Okay,
I'm
so
the
and so
triple positive, so
triple positive, and so I'm ERPR positive, like you with no other.
Okay.
And so for me, I still have my ovaries, and I do. They call it a AI Artemis inhibitor. I don't
Okay.
do tamoxifen. I did start with it. I actually didn't mind it, but I would mind it if I were you. Like I didn't mind it for me. I'm 8 years older than you, so yeah, I
Oh,
ain't care. But so yeah, you got some other options to say the least than
okay.
just rolling with that because that's a weird one to me. A little bit more often with young who still, are young enough to bear children.
yeah, that's fine.
Who knows that particular one, like tamoxifen to be exact, because tamoxifen is for women who are in menopause technically.
Hmm.
So right. So they're saying they want to put me into a medically induced menopause
Menopause. Yep, which makes sense. Makes sense.
because uncle test, my
Yep.
uncle test
Score.
score
Uh-huh.
was 51, I believe.
I think mine was 40. Yeah. Yep. Makes sense.
So
That makes
that
sense.
was his reasoning for saying that the most important part was for me to be on the tamoxifen.
Yeah, but you still got options because you can go on one that's called Lupron, where it's a shot and it turn off your ovaries.
So they want me to do both. They want me to do the tamoxifen and the shot.
That's what I was gonna ask. What do they think the tamoxifen gonna turn off everything on its own? I was wondering that. That's what I was just gonna ask. So that makes sense. That do make sense. Hmm. Okay.
So
That's
I
something
Do
we
would
gotta
you
try.
want to talk?
I
Huh?
guess
I'm asking Farida if she wants to talk.
Is she? Can we hear her?
We can't really hear her.
She probably still listening in.
Yeah.
Okay.
Yeah,
Yeah.
so I was, I guess, gonna give up on having any more children. So,
Okay.
especially because
Okay.
I didn't even consider it when I was doing chemo or anything. So,
That's fair. That's fair. Hmm. How was you ladies' 4th of July?
I was working.
mine
Yeah.
was boring.
Mine was good. I was ended up going to 2 different 60th birthday parties.
Okay. I know
Mhm.
that's right. That's a blessing.
Yeah, so
I'm
that was
60.
my well, that was the weekend. I was able to relax on the 4th itself. But on the weekend and the day before, those was the party days. And then I was relaxed again on Sunday.
How was yours, Tequila? You were recovering, so.
Girl, but you know, I'm a little squirrely brain. I was out in these streets. I ain't even gonna lie. I was right out there with my little walker in the mix of it.
Why you had to have a walker?
I got a scooter. Because you can't stand up straight.
Oh,
Yeah.
So you could walk freely if you can, but you gotta walk at an angle because your
Yes.
tummy has to begin to do that
okay,
stretching.
I got you. So you walk,
So
otherwise you would be walking bent down like that.
that's
And
how I'm
that
walking.
was
That's
me.
literally how I'm walking.
That's how I was walking.
Yeah,
Oh,
that's literally how I'm
because
walking,
of
running down the street.
the stomach.
Yep,
Yes.
yep,
Yes.
because of that pulling.
Yes.
So
And
there's
ooh,
nothing you can do. Nothing. You just
I
gotta.
mean, you
it's
to a
I,
certain extent, it's
it's
not like
scary.
it's not like it's going to open back up because the mistake that I made, I was bent over a little too far. And when I went to the doctor, I think it was like a week or two later, they was like, you can pull up a little bit. I was like, really?
Mm-mm,
They was like, yeah, pull up. You're fine. And I
mm-mm.
pulled up a little bit. I was like, oh my God. And they was like, no, not all the way, but not, they was like, you looking like the hunchback of Notre Dame right now. We need you to pull up.
That's me.
And so I pulled up a little bit, and my nurse, Meredith, she said the more you walk, because in my old house we had a long walkway. So she said just take, every day just walk up and down that hallway. And she said the more
Hmm.
you walk, the more your body is gonna eventually pull itself up, and then you're gonna be
Okay.
starting to walk straight. And it's
Oh,
like you'll never know. She said in your mind you think you're gonna bust it open. She said it's not gonna come
It
open.
feel like that. And let me
It
tell you,
feels like it.
TMI all day long, but that's why we here because we ladies. But I swear to God, y'all, it feel like somebody took all of the skin from my legs down, including my hooter rooter, and just pulled all of it up and said, we finna hang it on a hanger. The little clip-on hanger. You know, I'm talking about the little hanger with the two little hooks.
yeah.
And they say, don't move too much, because this is just what it is. That's how we feel.
Oh my
Like you
gosh.
trying to keep all of that in place
Yeah.
because they didn't move.
See, and I
They didn't
have stairs.
Oh, you'll be fine with the stairs. The
Okay.
stairs is not that ain't even the girl. That ain't the hard part. That ain't.
Oh,
No,
Yeah, you'll
the
be
it's
fine.
hard
fine.
part is walking then.
Yeah. And
It's
sleeping. I would say sleeping.
ooh,
I would say sleeping because you're sleeping on your back, and
Oh,
and if you turn a certain way, it's like oh no, and then you turn over, oh no.
it
So
don't
you
matter where you
like
go.
this,
Ain't no getting away from
right?
it. I
So
So
felt
you
it's
like
need
I
one
was
of those beds that, lift
an
up.
yeah.
adjustable
I
base.
had
It
the
Yeah.
can get
pillow.
from the feet and the head.
Yeah, I had
Yes.
the pillow, and then I had the one that you could take the foot part, and I put my feet. So I
Yep.
literally was like up like this, and my feet was up like this. So
Right.
I was slept like this.
Yeah, I have the pillows too,
I
so I
slept
know
like
exactly what you're talking
a
about.
yeah. That's exactly how I slept. Yeah.
And it's crazy because I got an adjustable base bed, but I've been sleep on my couch for 3 weeks.
It's
yes,
probably more
where you are
comfortable,
now,
right?
huh?
Yeah.
Huh?
Is it more comfortable?
No, and I'm in my garage. No, I'm in my garage right now.
Oh,
In my pool, but
so
yeah,
how did
it's
you?
more.
Oh, you got a pool in there. That's
Yeah,
why.
my husband, he doing the most. But yeah, it's more comfortable getting up and down. And then I'm closer to the kitchen.
That
I'm closer
part.
to
Yeah,
my
makes sense.
snacks
That
and my
part.
wine.
Mhm.
The air circulates different because I will say this. But again, y'all probably look, y'all can't relate, Francis and Sonia. Y'all done had boobies y'all whole life. Baby, I don't know how y'all been sweating like this. This is madness. I feel like I need to make a whole little brew, whole little powder concoction.
Yeah.
I
Because
thought
you
I was,
going through menopause, right?
and I'm doing that, but this ain't that type of sweating. It's only around
Under
these
it's in
boobies.
the boobies. It's in the
Oh,
boobies. It's sweat like in the crack now. You got a
It's
little
the
crack
front
sweat.
under my arms. I thought I was waking up in pus
See
because
me,
oh.
you have
see
those little drains, but
See,
it
me and
wasn't.
Tequila, we was we was in the
It
itty bitty
itty bitty
club.
to me.
So
This is
we weren't used to, how people say they sweat and they gotta put
mm-mm.
paper towel and we
Yeah.
weren't used to it. So we have it. Now that we got some, it's like, oh, I got sweat now. What?
And waking
Right.
up,
It is
Yeah.
literally
I
like I
used
got
to
a
put
weighted blanket.
deodorant here
yeah,
and under here.
Girl, I think I need to do that every day. I'm like moving a little bit, and I'm like, wait a minute, what's that smell? Hold
Right?
up, what's that smell?
Yes.
Like, wait a
Yes.
minute,
If,
hold up.
yes. If you sweat there, if you feel a
yes,
little
it's
bit
a
of sweat, you
smell.
gotta go get a baby wipe or a
Yes.
tissue or something and wipe it. 'Cause
I've been
otherwise,
throwing
yeah.
and throwing and rose water, and it's not. And right now, of course, the smells I'm smelling is because of them cleaning, doing all of that medical cleaning to attach me.
Yeah.
So now all of that stuff is secreting. Because believe it or not, I don't have to wear deodorant.
Mhm.
Right.
I didn't wear deodorant really before chemo, but I really don't have to wear it now. So I
Mhm.
haven't worn deodorant in like 4 years almost now.
I
But
wish that was me.
I can tell that, from them needing to disinfect the skin from when they took the mastectomy to this, that, and the other. But just that hospital smell attached to
Yes.
sweat is like, oh, what is that smell? What is that smell? And I'm not accustomed to that because I was flat before. So
Yeah.
Yeah, that's right. The
and
last
then I gotta
time
put all that
you were
coconut
fat.
oil on me.
Mhm.
Yeah, and then I gotta put all that coconut oil on me because now I've got my skin stretched in areas that ain't never been stretched. So I'm scared I'm gonna scratch and cause
Hmm.
bruising.
Mhm.
So it's I'm complaining, but
That's
it's
a
good
process.
justice.
And then
It's
you
good
live in
It's a
justice.
Florida
process.
and it's hot.
Yes.
As
Yes.
hell.
Mm.
As hell. Just going
Yes.
from the car to the garage, and I'm just like, and because you at a hunch, it feel like it wear you out quick. So
Yeah.
I've been like napping it to the death, and I'm kind of one of them people like I walk 3 to 6 miles every day prior
Mm.
to this. You know what I mean? I'm constantly on the go. I homeschool my kids. I work from home. I do my thing. I'm always on the move, baby. I said, oh Lord, this
Yeah,
been
who's
setting me down.
driving the kids now? Your husband, right?
And I'm just stuck on the passenger side. I'll be like feeling miserable, like, oh, can't wait till
'Cause
I could
I know
drive.
you be taking them
Yeah.
I'll
everywhere.
be on the mission. So
He
yeah, it's
definitely is. Whenever she's on the Zoom, you'll see her in the car
on a mission. We be on the road on a mission.
with
But yeah,
her kids. Yep.
it's overall it's definitely been good, and it's been crazy because my husband he was gone for the California cleanup, so he came back the 2 days before I had to have surgery, so that worked out perfectly. But now he's gonna leave for the Texas cleanup, and
Oh,
I'm like, man, yeah, I'm
they're
gonna
with
figure it
you,
out, huh?
the kids.
Yeah, the kids heard. Yeah, we'll figure
Yeah,
it
you
out.
got an older daughter, so she can cook for you.
Well, they just and then my other daughter and my son-in-law, they just left too. But
That's what
I ain't gonna even lie, I was ready for
I'm
everybody to
saying.
go.
Your older daughter, she could do a lot for you.
Yeah, yeah, they fine. But still, it's different. He do it like I want it. So
I
he
hear
know
That-
how
that.
they go.
Yes.
Oh, that's what it is. He does like
So
you want it.
Yeah.
exactly how I want it. Like, all right, because he don't want to do it again. So you know how they go. But overall, I cannot complain at all. I'm interested to see how this is gonna work out, considering the whole scar reduction, because you do get to go so they through like scar reduction. Well, Tamika, you would tell me, what do they do for scar reduction?
No scar reduction for me. I just
They didn't. They ain't do that.
I just
You know, Moffitt a little extra.
Look,
Coming
I'm
over
That's
like,
what
here.
I was getting ready to say. I was
because
getting
I'm
ready to, maybe
thinking
that's just a
scar
Moffitt
reduction.
thing.
What is?
Yeah.
Look, you schooling me? What is
Yeah,
that?
Moffitt is a little extra. I ain't gonna even lie. And we
Yeah.
go together. Look, we go together real bad because I like it.
Yeah.
Okay? I ain't mad about it at all.
Because did you tell them what Moffitt is? So they understand Moffitt is like the #1 cancer center in Florida.
Well,
In Florida.
they
Oh,
Okay,
well,
so they're like
actually,
they're like
it's
MD
the
Anderson.
top in the country though.
They're
so
like MD Anderson.
they're not the top in the country like MD Anderson. So MD Anderson, remember y'all, is who I told y'all I went to go get my second opinion when I first had found out. They're in
Mhm.
Houston.
Right.
So but Moffitt was like in the top 10, but COVID hit them. So I
Oh,
actually
okay.
so they was scared to go to Moffitt because I looked up Moffitt and Moffitt had failed to 26, but it was
Yeah.
because of COVID death related issues and everybody got hit
Right.
in that
Mhm.
Okay.
capacity. But no, literally in Florida, in the South, they're kind of like you can't mess with them. Like the governor, her wife got breast cancer. They don't live in Tampa. She came to Tampa. The
Mhm.
people, I don't know if you know Sonay, the CEO for Florida Cancer Centers, his wife got breast cancer. She didn't go to Florida Cancer Centers. She went to Moffitt. So they're a
Mhm.
little, they're a little extra in a sense. And they get a lot of money and they tie with
Yeah.
the university here. So yeah, but
Right.
they do scar reduction. And then they also told me they'll be
So
doing something
what
to
is
where
scar reduction? What is
I
scar
don't know.
reduction?
She
I don't
don't
know
know
yet. So
yet.
Well,
I'm
We're
hoping
gonna
let
find
me
out.
know what it is.
well,
Right.
I'm
Let
hoping
us
you're
know what
gonna
it is
tell
when you
me.
find out.
And they told me they're gonna do scar tissue reduction.
Mm.
Ah.
Okay.
And now that I'm assuming has something to do with like, if you get like that keloidal skin type of thing
Right.
underneath the
Okay.
scars and
Okay.
all that. But
Okay.
they told me they gonna do adjustments on me for up to 2 years as I want them. They told me they doing look, this how I know they
Look
extra.
up
So
this
now
scar
this how I know they
reduction.
extra. They just told me 2 weeks ago that I can get lipo in my arms. That's covered by insurance.
Because what that got to do with anything?
Because this one arm swells from lymphedema.
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 From
And
lymphedema.
they will
Oh,
use that fat
so
for my
they
boobies if they want.
Yeah, they'll
okay.
put it back in your boobs.
So yeah, they're a little extra. I have to remember that from time to time. I ain't gonna lie, they had me a little nervous. I thought that was a good old boys club when I first came. I ain't gonna lie.
Yeah. Yeah.
I was
Why?
like, what is
Why?
this?
They got
Uh,
they got everybody in there.
mhm.
You said it was a good old boys club. What's in that
Man,
house?
it was just, yeah, it was just real Caucasian, and I was a little nervous.
Oh,
And I didn't see none of my people. And then that's
Yeah.
when I heard that the people here was more they had better relationship with St. Joe, is what I heard. That's what I
Mhm.
heard. And that they were hoping to gain some people of color clientele more in Moffitt because the relationship,
I
like
tried.
the race relationships weren't great, is from what I gather.
Yeah.
Damn, right now you infomercialing them. So they need to look, thank you for
You
your
need a check.
pay. Okay.
Now I ain't gonna even lie. I was gonna leave. I was gonna leave her, but I didn't even leave her because of my level of comfort. I'm like, they saved my life. I feel good. I'm comfortable here now because I was
Gotcha.
going to leave her and go back home where I
Mm-hmm.
knew, you know what I
Mm-hmm.
Right.
mean, was
Me
good for
too.
me.
I was thinking the same thing.
I ain't gonna even lie, because I'm like, breast cancer, what the hell is that? I don't know nothing about this, and I don't know nothing about these people, medical stuff. I'm not fooling with this. I was ready to go. But a lady, my oncologist, which was a young black girl at MD Anderson, was like, I don't want you coming here because I had just moved from Dallas. She was
Mhm.
like,
Mm-hmm.
I don't want you coming here having treatment. I know somebody that's at Moffitt, and I'll give you a contact. I ended up just doing some research just based off of that, and I ended up getting my oncologist. She sit on the board, and I ended up getting the breast surgeon. He one of the top ranking in Florida too, as the people that I chose as my doctors. But of course, I'm just looking at, their bedside mannerisms, digging to find out what kind of incidents they had, blah blah blah, and come to find out, I ended up picking the top people that was actually in the institution.
Right.
So I was happy with that,
well, that
and that it
hospital
worked.
Moffitt is that busy that they don't take new patients and stuff.
It is
They take them.
crazy.
They do
It,
take them, but
they
it
do.
was like I had to wait. Like they were asking me to wait for like a month for my initial
Ooh,
appointment.
diagnosis. Mm-hmm.
Yeah, just to be seen,
Oh
Yep.
you
wow.
know. Yeah, so I was nervous to wait. In hindsight, I know that I probably did have a little bit more time,
Mhm.
but
Yep.
I was nervous to wait because I felt like this thing just grew out of nowhere and
Nowhere.
Mhm.
fast.
Yeah.
It felt
Yeah.
like it happened really fast because it wasn't there before. You know what I'm saying? So I was like, no, this is growing fast. I can't wait no month. At least that's how I
And you
felt,
know
you
what's
know?
crazy now that you say that though? I was diagnosed in December the 19th.
Oh yeah.
And I didn't have my first Moffitt visit until February. So you're right.
Yeah. Yeah.
But once I had my first visit, baby, it wasn't no turning back from there.
Yeah.
Oh, they gave me the only thing they told me to take some time for is if I wanted to keep my hair.
Mm.
And it was down, it was and I was surprised that the lady that I saw was promoting me keeping my hair. And I had locks.
Yeah.
And she was like, let me give you a little, a little time before we get this started just to see. This is the option. This is one of the options we know. And you let me know what you want to do. And I'm like, this lady worried about my damn hair?
Yeah.
Like, that's dope. I thought it was dope. You know what I mean? For real, because I do know how women are very much so attached to hair. And I didn't
Right.
even realize I was, right? Until I had to watch it fall out the way that it fell out during that process. But I
Right.
was kind of taken aback by like, we're talking about hair. So I think, going through the whole cancer thing make you question your vanity in some, you know what I mean? In some sense.
Boy,
So
does it question your
your
vanity.
vanity, you know what I mean? So eventually though, she that conversation about the hair was the only reason why we didn't go like right away. But
Mhm.
you're right. It took me literally it was about a month and a week before I saw them, a month and 2 weeks before I saw them.
Mhm.
Yep.
Wow.
So yeah. But
Like
what was
Have you,
funny too,
have you,
by the time they were ready to see me, I had already had my mastectomy.
Mm.
and they don't touch you once you've been touched.
Mhm. Yeah, that's correct.
Yeah,
Yeah.
they won't. The only way that they will touch you is if you had to transfer from out of town.
Mm.
Mhm.
So you would have had to be.
I think that's
Yep,
most
yep,
oncologists, or well, most props
yep.
doctors,
They won't
period.
touch you once you've been
If
touched.
they already touched you and done started treatment or surgery or
Yep.
anything like that, they don't wanna
They don't want to touch or
yeah.
tap dance on top of it.
Well,
Yep.
they didn't tell me. I had told them, and they didn't tell me that I had to cancel. I
Mm-mm.
just ended up canceling because I had already went through everything. So I was like, they were like, "Oh, well, just give us a call in case you want a
Because
second
they'll do a second
opinion or
opinion.
whatever." Yeah,
Exactly. They will do a second opinion. And I think that that's worth it to even
yeah,
have. I do think that that's worth it to have because I've seen 3 different physicians and between them, certain things have come up to make me question that first opinion. You know what I mean? Even though, thank God, it was never anything that was like a life or death scenario, but
right,
it was like, dang, okay, wait a minute. One little stroke to the left this way or that way could potentially have altered how certain things may have appeared. So I do think even having them in your back pocket for a second opinion, like you can even have them in your back pocket for a second opinion for your medication choices.
Mhm.
You
right.
don't
Mhm.
have
Okay,
to just have it for, like actual treatment. So I
okay,
think that that's worth it, even for those types of things. Because that medicine, I don't think like a lot of people really clearly understand like the severity in those lines of treatment.
right,
Having a mastectomy is a line of treatment. Having chemo is a line of treatment. Going on tamoxifen is a line of treatment. Doing the
right,
AI inhibitor. You know what I'm saying? Some people don't really think about like how quickly you can exhaust those treatment plans.
right,
And so that's why I think like, you know what I'm saying? Even if you're for whatever reasons, if you get any inkling of like, what I ain't like you keep talking about this tamoxifen thing. If that's something you concerned about, baby, I'll be right on the phone. I'll be right on the horn, calling them and asking. You know what I mean? Because they're gonna, of course, you could take advantage of the fact that they have oncology for those other reproductive issues that fall under that same window where you're questioning about potentially never having children because of this decision. And very
right.
similar to your PCOS, you could have caused yourself to have a delay with having a baby had you follow suit with the first you know what I mean, first piece of
Right.
information you're given. So I think it's worth it to exercise. Like I said, girl, I be bleeding these folks crazy with this insurance. They gonna kick my ass off. Okay. Shoot, they gonna kick me off in a minute. They gonna be like,
Not. They're not gonna kick you off the quill.
they gonna be like, we is done. She done tapped out of this certificate.
Yeah.
But you're right about the hospitals. If you go to one and you come from another one, they won't treat you. They're gonna send you right back.
Mm-hmm.
Yeah.
Yeah. Because
That's what I had a
I
couple
went
friends
to
that had that.
one, and like you said to people, I did not like that lady's explanation because
Mm,
she said, "Oh, you have stage 2, but you're the breast surgeon. You ain't even do nothing yet.
Mm-hmm.
How do
mm,
you know?" Yeah.
mm.
So then she goes, well, let me send you to an oncologist and let them tell, yeah, and let them tell you. But you're the breast surgeon. You're supposed to be doing the surgery. You're not supposed to tell me my stage. How do you know?
So I don't know if you noticed though. I found this out too. You do know the surgeon is the hierarchy over all of them.
I was just about to say that because that's who I saw first. My gyno sent me to two surgical oncologists first. Those
Mm-hmm.
was her and a general. She gave me three. She gave me two surgical oncologists, and then she gave me a general
Yeah, you
surgeon.
can.
And when
Yep.
I seen the general surgeon and they did everything, I was like, nope, let me just stay over here with the breast surgical oncologist. And then
Mm-hmm.
once when they actually how they did me was my mammograms was not attached to Methodist. It was attached to the mammogram center that I went to, which was TOPS. So I had to sign a waiver for me to get my all of my mammograms that I had ever had from TOPS to give it to the surgical oncologist office before they even seen me, before they even made an appointment. They
Mm-hmm.
asked for my mammograms. And then after they seen my mammograms, they said, okay, we can set you up for an appointment. And yes, they are the one that actually told me that I had stage 2, grade 2B. And like you said, that was the second opinion that I got. I went to another breast surgical oncologist. She looked at all my files and she said the same thing. And then that's when I went back to the original one because of the bedside manner. And she was the one, this Dr. Yoga, that sent me to the oncologist.
Francis, it sounds like that was exactly your experience. It's because
Mm-hmm.
you got hit with that dose of that surgeon, and they
Mm-hmm.
kind of be a little.
But I'm saying, the GYN, that's my buddy. She told me I had breast cancer. She sent me to this one. She was like, she's good.
Mm-hmm.
I go there. Her bedside manner was horrible. Oh.
Yeah.
Mm-hmm.
When I
Mm-hmm.
say horrible, she turned me off when she started yelling at the receptionist. And the
Oh
first
wow.
thing she asked her, did I pay? I'm like, I'm looking at my cousin. I'm like,
Mm. Oh
Yeah, no,
this
it was
is
time to
not
go
working.
anyway.
yeah,
Yeah.
this not the one.
She
Yeah.
sent me
She wasn't the one.
she sent me to this top oncologist at Montefiore, and his bedside manner was off, period. I was like, as soon as he walked in, he was like, chemo. I'm like, that's it? You're not gonna
Mm.
examine me or nothing? I was like, you know what? I'm going to Memorial Sloan Kettering. Okay.
Mm-hmm. They're bomb.
So he was like, so who was you gonna be? Who's you seeing? I said, Dr. Zucchini. And he was like, I know him. I said, good.
Mm.
Mm-hmm.
Will not see me here again. And I
Yeah.
think that. So I'm gonna tell you, when I say Sloan Kettering work fast, they work
Yeah.
fast. They were like, they set up an appointment, but before I can go, you had to get your report, and it had to be on a disc.
Mm-hmm. Mm-hmm. It gotta
Needed
be
to
on a
be,
disc.
yes, they got
Mm-hmm.
that. The doctor looked at it, and yes, I did have cancer. So I asked the surgeon, I'm like, so what stage is it? He said, that's not my job. My job
Yep.
is to remove it, and I send you to a medical oncologist where they can tell you the stage. And yes, she did. And ever
Mm-hmm.
Mm-hmm.
since that, I was fine. I went to a radiologist, oncologist. She explained what she was going to do.
Mm-hmm.
So I even had to go to see a dermatologist, oncologist.
Mm-hmm.
And he was like, yeah, he was like, you got all these different, he said, you and this other lady got the most allergies I've ever seen.
Mm.
Yes. Then I
Yeah,
went
I'm
to
going
the
to.
dental oncologist. They have dentistry with on
Yeah.
that deal with. I
Yes.
had to go to that. So my experience that first time with that doctor at Montefiore, that turned me off. And I
It's
Yeah.
never
always that bedside manner. I don't
yeah,
care how much of a top surgeon or hospital you are. If you don't have good bedside manner, that ain't gonna make your patient feel at ease to be with you. Gotta have good bedside manner,
yeah.
and the patient.
And the crazy thing is that my endocrinologist, no, yeah, my endocrinologist, he knew him. No, my gastroenterologist. He knew that doctor, and he was like, he's really good at what he does. I said, but he ain't got no manners.
That
What
Mm-hmm.
matter? He said, yeah, he could be a little rough. I said, well, he can be rough with somebody else.
Right.
Now, crazy thing, when I was at Memorial Sloan Kettering, that same doctor is the one that treated people with that Herceptin.
Mm.
He did that. And then the nurse, she was like, yeah, he's rude, Francis. She knew him from working at the same hospital. But they say he's
Mm.
smart. I say he's smart and rude at the same time. But I said, I don't care how smart you are, it's your bedside manner.
Right.
You're not going to
Yeah.
talk to me like I'm somebody off the street and kick me out the door and tell me you didn't even examine me. You never looked at me. You just looked me in the face and said, you have breast cancer and I'm going to send you for radiation. That's it. I mean, not radiation, chemo.
Mm,
Mm.
And I'm
Yeah.
like,
Look.
"Ugh." And I'm like, you're not even going to check me? He was
mm,
like, no, you're just going for chemo. But I didn't notice he wanted me to go get my heart checked. That's the only thing I remember. Because they set up that appointment. Surprise, surprise, I never went.
Mm.
Yeah.
Look, y'all, I think look, y'all got me feeling, because baby, I think I know I've been living half my life, not no more, thank God, to cancer and fight or flight. I ain't care nothing about your bedside mannerism. I needed you to be educated. We could fight it and duke it out the whole time. I needed you to be educated. I needed you to be a non-conventional thinker is what I needed. But I also want you to use your what do they call it, classically trained education. And I don't care how dumb you thought I was because you was gonna find out. I did not give a damn about no bedside mannerism. I need because I think I've seen so many people um perish, be handled with care.
mm,
Meaning, and what I mean by that is that I had a cousin who ended up passing maybe about 3 weeks before I completed my treatment. And it was because she really liked her doctor, and her doctor was so nice to her. But she did everything her doctor said do and never
mm,
questioned it. And I think that that bedside mannerism sometimes can be manipulated upon the patient. You know what I mean? As far as they need you to be cooperative. You know what I'm saying? And if you don't function within the script, at times for some physicians, it's a shock. It's a shock to their ego. It's a buck against the system. You know what I mean? It's just you making them have to work outside of their normal. Hey, get this person like Sine said. I didn't take the Red Devil. I took the doctor so and so. Blah blah blah. Right? Like they already have all these scripts in their mind. And so for me, the bedside mannerism came on the back end. I need you to be smart. I need
I
you to
know.
be
You
a
want them to be
whipper
smart, but you don't want
snapper.
them to be rude either.
I ain't, that's why I said,
I don't
Francis, I
think
think I'm
I don't
coming
think
from a
it's
different area.
necessarily the rudeness for me. I think it's the more so treat me like I'm your sister, your daughter,
That
your
was the
child.
question that I asked both of my doctors.
Right.
Is
So
this
that's where
your
I'm at.
sister?
You can be rude all day
I
long.
don't give a
That ain't
damn.
gonna,
Because I
but
don't like my sister.
it's the I don't want to be treated like cancer patient number
Right.
535. I want to be
Mhm.
treated like Tamika Baker.
What? And
And
you gonna know my name?
right. When I would literally my doctors, when I came in, I had a notepad and we went in it. We like you said,
You have to
they were
ask
nice, but
questions.
it was still well now I read this
Mhm.
and this is what I saw and why is
Mhm.
this and why is that. It was a back
Mhm.
and forth, even with my surgery. And they originally told me you gonna have all your stuff this year, 2022. You ain't going in 23. We ain't gonna worry about no surgery in 23. We gonna worry about recovery. That December, I think it was November came, and they was like, well, we can't get you in for a surgery. We gonna have to put you in January. I said, no, you're not. I said, y'all said I'm gonna be good before the end of this year. I don't care how
Mhm.
y'all figure it out, but we gonna have this surgery this year. And I ended
Mhm.
up having it right. Literally spent Christmas in the hospital.
Mhm.
So
Mhm.
I'm like, what we not gonna do is what
Mhm.
y'all said. This is what we was talking about. This is
Right.
what we gonna do.
And those are the things that I mean, like, you know what I mean? For me, that's what I said. It wasn't even like like I said, I come from fight or flight. That's my trauma. That's my bag to carry. You know what I mean? Like, and for me, I'm like, hold up, I got 4 kids. I can't go nowhere.
Yeah.
You may do this all day, but you gonna need to know that Tequila
Mhm.
situation ain't Keisha's, ain't Mary's, ain't none of that.
Right,
And
right.
I understand that you're gonna see 50 different people all day long, but you're gonna remember that you can't pronounce my name when
That's
you
right.
see me,
That's
at the
right.
end of the day, because this is my I only have one vessel. You dealing with 50 of them, but I only got one.
Mhm.
And so for me, that was my literally, I let them do their little, I even cut them off on their spills because you could just tell it's a spill, and I'm just like, look, at the end of the day, what would you want your sister to do? What would you want for your sister? Because I don't even
You know,
like my
I
sister.
always
I don't
ask the
want her to die.
doctor, so what would you do?
Yeah, what would you
That's
want
my
for your
question.
sister? What would you
What
want for
would
your
you
mother?
do?
Period. And so my male breast cancer doctor, my breast oncologist or whatever, was just like, I can't tell you what to do because I don't have breast, or whatever. And I was like, all right, I respect that. He was like, but what I would recommend, if it was my sister, I wouldn't play about keeping it on and trying to play this lumpectomy game. And so that allowed us to have a very candid relationship. And I just seen him today and he was like, what up, Tequila? I'm like, you play too much.
Don't
Doing
you just
uh,
love it when you go in and you're not like, hey, Tamika,
you
hey,
know,
Tamika,
right,
hey, girl, hey, hey, girl, hey, how you
and,
doing? How the
and this is
kids? How the
and this
wife?
is
How the...
Moffat, right? Yeah, this is
That's
Moffat. Like they
because
are
you two
very
still see
personable.
your
Right,
breast surgeon.
but even with that, I literally can walk in my doctor's
Mhm,
office, have a
mhm,
conversation with the front desk, the nurses, the doctors, them other patients sitting there like,
I
cheers,
know.
you just coming in like it's her house and you think,
exactly.
oh
Because I
yeah,
know when I walk in
right.
Sloan Kettering, I'm like, hi, how you doing?
And not only that, like I'm not, and what they came to learn real quick is I ain't rough with you because I'm trying to be problematic. I'm rough with you
Mhm.
because I need to live. And once we get past the
Right.
rough part, I promise you, 90% of me is sweet,
Mhm.
and that's what you're gonna
Yeah.
get. But I'm not gonna be agreeable. That's not what
Mhm.
I'm gonna do. And so my oncologist, it was so funny. Our first little battle, we went back and forth, and she was like, that can't be true. Just telling me something about me, which I had already had blood work about it, and I
Mhm.
think I shared that with y'all before or whatever. But and from there, just that one incident, like from that point, allow her to let her guard down. And her nurse said she ain't gonna apologize that she was wrong, but she knows she was wrong. And I'm like, I don't need her to apologize. I just need her to show up and be
That's
listening
right.
when I'm
That's
talking about
right.
what I'm talking about. And
Mhm.
so I don't know if any of y'all did Taxol,
Yep.
and I did the Taxol for 12 rounds on
I
that
did
one.
that. That's what I
Mhm.
was trying to tell you, son, that mine was that Taxol, the
Mm.
other
Hmm.
two that you had, and
Mhm.
Hmm.
Herceptin. So it was TCPH, something like that.
Hmm.
Yeah.
I had 4,
Mhm.
Hmm.
and it was every 21 days I was gone.
Oh,
Mhm.
see, my Taxol was every week.
But
Mhm.
And
I had 4 types of chemo.
got you. Yeah, I
'Cause
did too.
I had the lumpectomy,
Yeah.
Mhm.
And, I really tried to get him to cut it off. And he was like, nah, you don't need a morph. Got a little tiny bump there. I was like, no, cut it off.
Mm-hmm.
He was like,
Oh, yeah,
nah.
you lucky. Yeah, and I remember when I went in, because of course I've been battling my white blood cell count, and my doctor was just like, I'm like, look, you steady giving me these damn shots to increase them, and then I'm plummeting, because she was like, well, I want you to do 3 of them in a week. I'm like, you know what? Just based off of the previous week, this system don't feel right. Let's do blah, blah, blah. And she started, just like, you know what? Let's do it. You know what I mean?
Mhm.
Because I'm going off the same data that you looking at. You know what I mean? It's no different.
You
Let's just
didn't
work
get new
together.
Lasta? You didn't get that new
Yeah,
Lasta
yeah.
patch?
Well, when you do Taxol, Neulasta, is too. There's not enough of a break between it. When you do Taxol, because I had to do Taxol that was every week, I
Yeah.
had to do an injection in my stomach like 3 times a week, which is way stronger than
So you
Neulasta.
just had Taxol, right?
No, no, no. I remember I had the Red Devil and I had
Oh,
what
yeah, that's
Soleil
right.
had talked about. I had the two that Soleil talked about. So I had 4 too. And then I did 16 rounds.
Oh,
And I had the Taxol by itself. And so, but again, once you get past that rough patch, you know what I'm saying? We learned that it was like this, we in this game together. It's not just yo scenario. And what I learned from my cousin who passed was that, and I won't say that, do any blame with her, but I know that she didn't ask a lot of questions. And I'm learning that some people don't ask a lot of questions because it's above their capacity. And
Mm.
this club is hard. It's thick, right? You know what I mean? It's hard to process. But her heart ended up being damaged from her chemo.
Mhm.
And, but she was on her second bit with breast cancer, you know what I mean? And so, but the first round appeared to be what had damaged her heart,
so you had
and
radiation?
no, it was the chemo that damaged her heart.
Oh,
And
'cause
that
I
is
know I
they
had the
tell you,
radiation, so.
well, they tell you that the chemo has the capacity to do that, which is why like you said, when they told you to go ahead and get that heart, what's majigga before you
Yeah.
got on chemo, because they want to make sure that your heart is strong enough to be able to endure, because that stuff is going right into your heart through that port,
Right.
Well, I
whatnot.
didn't go to court at first, I
Mm-mm.
argued with them.
Oh, girl, please. I
Yeah,
don't
they
know how
was
people
like,
do it.
they was like, you can't do your veins no more, get the port. I was like, I don't want nothing going into my heart.
Yeah, that
Then they
I
put it
they
in
took
and
my
I was
port out.
very happy. I was
Mm,
happy because I didn't have to do the blood work and the
yep,
arm and
yep,
go to the port. And that's
yep.
it. Yeah, so
That
I was
port
happy
was
with the port.
Yeah, that part was lovely. But yeah, overall, y'all, I mean, hey, look, I'm glad. Look, if nothing else, I'm glad that y'all all had a better 4th of July, whether it was boring. Sometimes boring is good.
I
Sometimes
was just
boring
home
is
alone. That's
good.
all that was about.
Than
Yeah, 'cause her
anything.
baby is not there, that's why.
Yeah, my fun is in New York, so.
Okay, okay, okay. Yeah. So yeah, I was glad to hear I'm glad to hear that from y'all, because looking at that devastation that hit those other folks on the other side of the
In
country, like,
Texas.
damn. Yeah, we could be in different state of mind. So hey, I
Right.
That
had
was
a good
sad.
old mine was boring too. So I ain't gonna even lie. I was just happy to get outside. I wiggled my way to the pier
Okay, yes.
and watched those little fireworks that they did for a minute, and then
You
came
know
We
back.
what the
usually do
pier?
that, but we didn't, my son's not here this year, so we didn't do it this year, so.
Yeah. See, we still trying to figure out holidays here. So, cause yeah, we ain't been here that long.
How long you
I've been
been
here
inside?
for 7 years.
Oh,
Yeah.
Okay. Okay.
we over
And before
7.
that, prior to that, I had lived here for like 2 years back in 2013 to 2015.
So you from New York?
Yeah.
Okay. Gotcha.
Yay.
Gotcha. Yeah, I lived here in 2020 or 20.
Mhm.
When the hell I lived here? I lived here in 2019
Mhm.
during COVID. Then I went back to Dallas, and then I came back here in 2022.
Okay.
And I'm like, yeah, nope, I think this is probably gonna be home.
So,
So
so
yeah.
wait, so
Yeah.
you always homeschooled your children, huh?
Oh yeah. My kids have always been homeschooled. They
And
only
that's
went to school. My youngest kids have
because
only been
your
to school
husband
for
moves
6 months.
around a lot, right?
Huh?
Your husband moves around a lot then.
No, it's really me. It ain't him.
So
Yeah,
he just
nobody
Do
really.
following
you
her.
teach them?
Yeah. Well, actually, girl, I got a grant from Florida. I get 8 grand a kid. and they give me money to do what I need to do. And
Lord,
so,
you the
yeah,
lady. You
hey, baby,
the
I'm a
lady I've
plug.
needed to
I'm
meet
a
all my
plug. I'm
life.
telling you, I'm a plug, man. Yeah. But yeah, so no, Francis, my husband, so technically I'm the move around person.
Oh,
And because of like the life I manifested for myself that I wanted was that I wanted to be able to live wherever I wanted to live. I
Yeah.
didn't want to have to depend on the school system, and I didn't want to have to be anchored with a job in any set
Yes.
location. That's always been something that I wanted for myself, and I manifested it, and I've been blessed with that since about 2017. And
oh,
it so happened my husband ended up being able to take advantage. Prior to this, we always had a courier business that allowed us the flexibility. But
That's
then,
crazy because I did that too. I
yep,
have one too.
we did courier work off and on for a long time. And but Florida is real janky with courier. Oh, they disgust me here with that. And but then eventually, before we came back here the last time, when they had a hurricane or something here, he got on with, like he signed up with them, and they actually happened to move around too.
Mhm.
So it's not a big deal to us if he does go and be like in California, because like he was in California from March, April to June, to just, I mean, right before I just had my surgery. He left in March and he just came back from my surgery on the 16th of June. But we have a place in St. Louis, so we'll go up there and be there for 2 or 3
okay.
weeks. But because I homeschool and because I work from home, we get to go wherever he at and just kind of enjoy their view. You know
Oh,
what I mean? Because his job pays for everything for him. They give him a car, they give him a hotel, they give him a daily per
oh,
diem. He don't buy food, he don't do nothing.
Mhm.
So it just kind of, like I said, manifesting that life, baby, and just, yeah, really just moving, taking advantage of the
well, I
moving
see
people.
it is getting dark on that side
Yes.
It is.
because I can't see sun and it's
It is.
you got
And it's
that
pink
blue light
outside. It's
there.
super pretty outside.
But she's in out, sun is outside too, but
I'm
that's,
outside. Yeah.
she's outside.
It must be darker on the side where you at, because it's so funny. Yeah, I don't know. It's pink out here. It's not totally dark here.
It's not totally
Mm.
dark yet, but I guess where I'm sitting
The
at is
sitting is
dark. I
dark.
Mm.
have a lot of trees
Well,
around me.
and you know what, that I keep forgetting, that's this blue light on this pool.
Oh yeah.
Extra something on this dang on pool that he put in here. I forget about that too. So yeah. Yeah.
Okay, well, this was awesome. Farida, the next time you'll be able to talk and see your beautiful face.
Right.
I
Get
guess
the
she's hearing us, but she's not responding because she was driving. Anyway, ladies, we're gonna end this. We come every, what's that, second Thursday of the month, Sana. If you're interested, I will send you the link
Okay.
so we can all keep up with what's going on.
Yes.
Yeah.
I'll
What
come back
new
next time. So we'll have my reconstruction to talk about.
uh-oh.
On the
And what
21st, right?
Yeah.
yeah.
Yeah,
Ooh-wee.
yeah,
So
yeah. That's gonna
everybody,
Let's
be a
talk
nice
before
we're
then. We're
conversation.
gonna talk
gonna
before
keep you in our
then.
prayers
Thank
Yes,
you.
yes.
Definitely.
And
for
we're
a
praying
Definitely.
for us
successful.
a great surgery and speedy recovery and
Right.
comfort and healing.
You see,
That's
Tequila,
right.
we prayed for her. Look at her.
Yeah.
That's right,
Big
baby.
old Colgate
She's back out
smiling.
there trying to get out there.
She outside.
Yeah.
Can't
All
wait.
right.
Okay.
Okay, this is the end of this segment of the resilience of Black women confronting breast cancer. Thank you, ladies.
Thank
Welcome.
you.
Yeah.
You stop recording yet?